in a Smart Consumer series and 33rd program, otherwise in a series on consumer issues which we started 3 years back. So it has been a long journey, and with everybody's good wishes, participation, we are able to carry on. My job is to tell you what is Consumers India. Consumers India is an intellectually strong organization. It was set up by former officers of Department of Consumer Affairs, and now it has doctors, academics, engineers, architects, students, professors, housewives, people from all walk. And
Dr.Jayashree Gupta, Dr.Naresh Gupta, Dr. Bijlani, and friends. I'm very glad that this subject has been chosen for today, because you know on 21st June we are celebrating the International Day of Yoga. 177 out of 192 countries will be celebrating. So obviously this has gained universal acceptance, irrespective of the nationality or the religion. I was in Dubai last month and I was surprised. There are more than 70 centers. Every park in Dubai is doing yoga there. And it is very, very popular. You must have heard in Pakistan and even in Muslim Iran, it's very, very popular. China and Japan have actually excelled. They have more centers than even India has. So it has become a universal thing. The public has started doing it. But the topic today is, how do the modern medicine accepts it? Well, I must accept that we have been rather late in accepting it. The reason is, modern medicine is evidence-based medicine. And
good evening, everyone. Always a pleasure to see you all interact. And the purpose, as Dr. Jayashree has maintained, is we want to make the consumers informed who can make considered choice. And the informed choice, considered choice should be balanced based on scientific evidence. Yoga is a way of life. It has done wonders. You don't even need a scientific proof for it. You can see the scientists sitting here. If you look at them, that itself is a proof that yoga must be very good. Looking at Dr. Manchanda and Dr. Ramesh Bijlani and now Dr. Jayashree. But today, along with yoga, which sometimes tends to get limited to the exercises, the physical part, the asanas or the hatha yogas, and Dr. Manchanda has clarified and Dr. Bijlani is going to clarify it even further. It's a much, much larger way of life. And medical science is nowhere close to that larger sphere. It's a very limited, focus. The scope is very limited.
2015 happens to be the silver jubilee of a very important event in medical history. Exactly 25 years ago, in the year 1990, Dr.Naresh published a controlled trial on patients having coronary artery disease in the prestigious journal Lancet, wherein he demonstrated that patients having coronary artery disease, when they are given a lifestyle intervention based on yoga, not only feel better, but they also get better. Get better in the sense that the narrowing of the coronary arteries in these people underwent a reduction over a period of 1 year, in contrast with the control group that did not receive such an intervention. In those patients, the narrowing effect increased. Now, this was not just an important finding, but in fact it was a revolutionary finding which changed the very paradigm in modern medicine. Because when I was a student of pathology, sometime in the 1960s or 60s, the impression that we picked up was that chronic degenerative diseases like coronary artery disease, either they get worse or at best would remain the same, they don't get better. Self-healing takes place only in case of acute diseases like common cold or diarrhea. Here he demonstrated that even in chronic degenerative disease, there are self-healing mechanisms available in the body, so that if the artery is occluded to the extent of 50% today, after 1 year it may be only 45%. The reduction was not remarkable. The reduction in the narrowing was not remarkable. But the very fact that it could take place was itself a revolutionary finding.